Good morning, good morning, good morning, everyone. It's Thursday, and it's a new day, and I've got a good coffee cup in my hand that says, "Wake me up when the big hand's on 12 and the little hand's on 5." Anyway, this is going to be a pretty extended coffee talk, because I want to just go through some information about the vaccines that was put out by the Association of University Centers on Disabilities and the National Center on Disability and Public Health that the other day. And this is just talking points. I'm not going to discuss anything. Um, and so I just want to talk a little bit. Um, the first point that I want to talk about is why get the vaccine? And if you're a person with a disability and you ask this question, why should I get the vaccine? The COVID-19 vaccine is a shot, like the flu shot. If you get the flu shot, you get it. It will protect you from getting very sick from COVID-19, just like the flu shot protects you from getting very sick from the flu. It's important that all people who get the shot get it. Getting the shot will help you keep you healthy. Getting the shot can also help you keep your family and friends and the people you care about get about healthy. It's very unlikely that you can give someone else COVID-19 after you get the vaccine. We know that people with some disabilities are more likely to get COVID-19 or to get very sick from COVID-19 because of the type of disability or disability related medical conditions. If you have one of these conditions, it's extra important that you get the shot to stay healthy. Getting the shot can help keep you can help you safely do the things you enjoy, like spending time with other people, going to work, like me, getting or going out into the community. I'll be right back. All right, sorry about that. What if a family member asks, why should I get the vaccine? You can say, it's important that all people who get the shot, who can get the shot, get it. And let me clarify that 1 second. I know some people have problems with vaccines and things, so it may not be good for them to get a vaccine, and that's all right. Like I said, it's important that all people who can get a vaccine get it. Getting the shot will help keep you and others healthy. It's unlikely that you can give someone COVID-19 after getting the vaccine. We know that people with, well, like I said, some people with COVID-19 will get very sick from it. And, so it's important that family members get the vaccine. What if a direct support professional asks the same question? Why should I get the vaccine? This is important, especially when it comes to DSPs. It's the best way to protect their family, friends, and the people they work for. It's important because they're more likely to get COVID-19 because their job requires them to work with a person very closely and close to other people, and sometimes multiple people. Getting the vaccine provides an extra layer of protection for them and the people they work for. Getting the shot can help them safely do the things that they do outside of work, like spending time with family, friends, and out in the community. Because we all know DSPs also like to spend time in the community. You know, what if a person says, "I already had COVID-19. Why should I get the shot?" Yes, everyone can safely take the vaccine. And yes, and medical professionals don't know yet whether having COVID-19 means that you are safe from getting it again. So be on the safe side. Get the vaccine. It will help protect you. May even provide an extra layer of protection. You know, what if a parent or guardian of a child says, "Should my child get the vaccine?" Well, here's the thing about that. All children with and without disabilities over 12 years old can get COVID-19 vaccine now. Children younger than 12 still cannot get the vaccine, but they may be able to also very soon. Getting the shot can help keep their child, family, and your child's friends and classmates safe. Some children with or without disabilities cannot get the vaccine for certain medical reasons, as I said earlier. It's important that you check with your child's doctor first before you get the vaccine. Getting the vaccine will help keep your child safe for a return to school, activities, and events with other people. We don't know how many children with disabilities were included in their first sets to make sure the vaccine was safe for children, but now many children with disabilities have gotten their first shots safely. Let's talk about vaccine safety now. Is the vaccine, if you ask, is the vaccine safe for me? And the answers are, the vaccine is safe and it works. You should contact a trusted doctor if you want to learn. A trusted doctor, if you want to learn more about the vaccine and how safe it is for you. Medical professionals worked on the vaccine, made sure it was safe for people from every background, age, and gender. To be safe, everyone is asked to stay at the place they get the vaccine for at least 10 to 15 minutes after they get the shot, so that a medical professional is nearby in case something happens and you have a bad reaction to the vaccine. We don't know how many people with disabilities were included in the first sets to make sure the vaccine was safe, but now many people with disabilities again have gotten their shots safely. And again, some people with disabilities cannot get the vaccine. So here's a caveat to everything. If you see something online on Facebook and it's not from the Centers for CDC or from a trusted medical professional group, it's probably not true. So check out what the CDC says about the vaccine, or check out what a trusted medical group says about vaccines. What if you're worried about the vaccine, being made too quickly? How do you know that it's safe for you? Researchers were able to do the safety checks for the COVID-19 vaccine more quickly than usual because many medical professionals were given money and time to work on it, and they relied on past reliable research techniques. How do you know that the vaccine is safe for your type of disability and health condition? Again, if you're unsure, talk to your trusted doctor. If you feel like the shots were made too quick, made you sick or hurt, you can tell your trusted doctor or ask a medical or family member for help. There may be things that they can help you with to, keep from making you sick. Give you tips on what to take. It's safer to get this COVID-19 shot and not than to get sick from COVID-19. Again, some people with medical conditions cannot get the vaccine. So please, if you can, get the vaccine. Is the vaccine free for you? Yes. The vaccine is free. And it's free even if you don't have insurance. So if you do have insurance, all you got to do is show your medical card, your insurance card. If you don't have insurance, you just got to fill out some paperwork. Do you need your insurance information to get the vaccine? I just answered that. No, you don't need your insurance vaccine information. You don't have to give it. That's your right not to give it. If you want to give it, you can. The shot's still free either way. You have to fill out some paperwork. That's for government for make sure that they know who's getting it and make sure they know when you get it, and to remind you when to come in for your second shot. If you're scared of the shots or needles, is there another way to get the vaccine? Currently, no. There's no other way to get the vaccine. No nasal spray like they had for the flu at one time, no pill and stuff. The only way to get it is through a shot. It's the best way to protect your body too. If you are afraid of needles, you can ask the person giving the shot to have a family member there to support you. You can ask to get the shot in a quiet, private place. That's your right. You can ask the person who gives you the shot not to tell you when they're giving it. To tell you what the shot would feel like. It may sting a little bit. A little bit more than the classic flu shot. And they'll ask them to tell you how long it'll take. And also you can ask them to tell you when they are about to give it. Some places even have a practice where they'll let you look away or look at the needle before they give you the shot. If you want to look at the needle, that's fine. That's your right. And it's important to know that you can always ask what you need to help you feel better when you're getting the shot. If you're asking will the vaccine sites be accessible to you, this is very important. Places that give the shot should be accessible to all people with disabilities. We know that that's not always true. Many pharmacies and grocery stores are now giving the shot. Those are good places to get the shot if you're worried about accessibility. Most of them are very accessible. And if yours isn't, go to somewhere else. You or a family member, support staff can call the vaccine site to make sure that the site is accessible. If there will be a wait time, maybe some places still giving appointment times, and to find out who will give the shot and any other questions you may have. Another question is, do I need to go somewhere to get the shot? Of course, yes, I've just said that. It depends on where you live. Maybe places can come to you or come to your place where you live. But in many places, a medical professional can come out to you in your home and give you the shot if need be. Some places have, many states and many areas have mobile vaccine clinics. Some are pop up, some are just, sometimes at baseball stadiums or at events. Um, I will say if you go to an event and get a vaccine, wear a mask before you get the vaccine and during and afterwards. Don't take your mask off. Wear a mask for up to 2 weeks after that vaccine. To find where you need to get a vaccine, you can text 438-829 with the words with the letters GETVAS. That's Get Vax. Or look at www.vaccines.gov or call 1-800-232-0233. That's a lot of places you can get information from. Also, there's a new vaccine help service for people with disabilities. It's called Dial. That can help you find where to get a shot, how to get help there, and any other questions you may have. You can call Dial. You can email them at dial@n4a.org or call 888-677-1199. What about side effects? We all have heard them. Will you get sick from the shot? The COVID-19 vaccine cannot give you COVID-19. Everybody will feel differently after getting the vaccine. Some people have a sore arm. Some people have headaches, feel tired, feel achy. Some people also have a fever. I will say that I just felt tired. That's all I felt. I was tired. I went to bed early, got a good night's rest. It's normal to feel these things, after getting a vaccine. Some people feel sick after getting the flu shot every year. You feel sick after getting the shot, it should go away after a day or two. If not, then you may want to call your doctor and find out what's going wrong. Some types of disabilities also make you feel sicker after getting a shot. You can talk to your doctor about this if you feel worried about getting sick after the vaccine shot and your disability. If you get a vaccine that requires 2 shots like Moderna or Pfizer, you might feel differently after each one. Some people feel sicker after the first shot, and other people feel sicker after the second. I had the Pfizer. I felt the same way after each one. So, some people are fine. It's safe and normal to feel both. Either way, it depends on your body. Whatever you feel, whatever you feel or don't feel after taking the shot, your body is still safer from getting the vaccine than from getting sick from COVID. These more points. If you asked, I heard someone got really sick after the vaccine. How do I know this won't happen to you? Everybody feels differently after getting their shots. That's normal. That's the human body. Some people are worse, some people are better. Like I said, if you feel sick after two or 3 days, you may want to call your doctor. Medical professionals have been working on vaccines like this for years. and will continue to work to make sure that vaccines are safer. You know, what if you get the vaccine, and can you still get COVID-19 after the shot? Yes, it's possible that you can still get COVID-19 after you get the vaccine. But it's still important to remember that the shot will protect you from getting sick or dying from COVID-19. Very sick, I mean. Some people with disabilities have a hard time fighting off sickness. Sometimes it's because of medical conditions or health conditions, or because of medicine they take that can make it harder to fight to protect against COVID-19, even after taking the shot. It's important to remember and to work with your doctor and to continue staying safe from COVID-19. If you have issues, you may want to stay away from general public more and more. It's likely that we might need a booster shot every year to keep us safe from the COVID-19, at least for the first few years, just like the flu shot. We'll find out. Do you still need to wear a mask after getting the vaccine and keep distancing from other people after getting the shot? Okay, this one is a tricky question. Yes, you may still have to follow some safety rules. Some places may still require it. If a place requires it, wear a mask. If a place is like it's your option to wear a mask or not, if you're vaccinated, that's your option. If a place says if you're not vaccinated, wear a mask, please honor their request and wear a mask. It's up to you to know and honor that. Buses, trains, planes, the Ubers, Lyfts, they're all still requiring masks, so wear a mask in their vehicles. Some safety rules may be different for people with certain disabilities in group settings. Honor them, and also realize that state and local information may be different where you live. Pay attention to your state and local rules and laws and regulations regarding masks. Where can I get a shot near you? I've kind of already answered this. Doctor's offices, pharmacies, grocery stores, some certain events. You may check and see if they're offering masks or Band-Aids. Sometimes even the airport has been offering a vaccine. I know Dallas Love Field had a vaccine deal. When I was coming back in May, if you didn't already have the vaccine, you could get your vaccine right there at the airport. Vaccines can be scheduled at different times throughout the days and the week. Some places will allow you to walk in. Many places will walk in now and get a shot without an appointment. Just check. I already shared the information about the Get Vax and vaccines.gov. And anyway, how do you make an appointment? Call your doctor, call your pharmacy, find out where you can go to vaccines.gov. It'll help you find a place to get an appointment. What if you don't drive to the vaccine site? Some local transportation services are offering free drives. Uber's offering free drive to vaccine sites. Check. If you can ride an Uber, check. Some taxi services are offering free rides. Check it out. That's the simple thing. If you want more information, you can go to cdc.gov and look up COVID-19 or coronavirus 2019 information. You can get more information there. Anyway, like I said, this is an extended coffee chat. Time for another sip. I hope you have a great day. Like I said, if you haven't gotten it, please do, if you can. If you're afraid, I just shared with you all the information about it. And so, anyway, y'all have a good day. Take care, and talk to you later.